Hello, my name is Dr. Jim McCann. I'd like to talk to you today about spinal stenosis. You know, over the course of the last over 20 years as a chiropractor, I've been confronted many times by patients and asked whether or not I could help with spinal stenosis. Well, if you've been diagnosed with spinal stenosis, you need to know exactly what's causing it and why it's causing you the symptoms, more than likely of numbness, of pain, of weakness, especially of the lower extremities. Sometimes it does affect the upper extremities as well. So let me explain to you exactly what spinal stenosis is. Spinal stenosis is a degenerative condition of the spine in general, which causes a diminishment in size of the spinal canal and less room for the spinal cord and the spinal nerves. So let's take a look at what the spine looks like. So here's what the spine looks like. What we have is a series of 24 freely movable vertebrae in the spine, hopefully freely movable. We have the spinal cord, which enters at the level of the base of the skull, where the brainstem and the spinal cord meet. They come down through the spine, and spinal nerves exit off of the spine to innervate every single cell, tissue, and organ in your body. Spinal stenosis is caused by a degenerative condition known as degenerative disc disease. This happens over our lifetime. Many times people are affected by it at a younger age. Most of the times people are affected by it as they get older because of a series of lifetime traumas that they've had. I'd like to show you a couple of lumbar vertebrae as they look if we remove them from the spine. So here's a normal lumbar vertebrae, and what you see when you look from the top, you see a normal disc, and you see this jelly-like substance in the middle of the disc called the nucleus pulposus. If as a result of the degenerative condition, this nucleus can actually get pushed out of the disc and cause stress and pressure on the nerve root or on the cord itself, that's called a herniated disc mostly. And if you've reached that point, sometimes surgery can help you. But if you've got all the way to the point where you have spinal stenosis, your lumbar spine more than likely looks like this. And this is a totally degenerated joint. And the disc has been just about fully lost. The disc has shrunk and dehydrated. The bones are trying to fuse themselves together. You get bone spurs, and that's what we're looking at here. And these bone spurs can go all the way into the spinal foramen on the sides of the vertebrae where the nerve roots exit. This causes stress and pressure on the nerve roots, but also stress and pressure on the cord itself, where the spinal cord goes down through the spine. In 1977, an orthopedic surgeon by the name of Alf Brigg did research, and he showed that with regard to spinal stenosis, if your neck is out of alignment and you've lost your normal spinal curve, and your curve has actually gone possibly even reversed or straightened, and there are misalignments that we call subluxations in your spine, this causes increase in pressure in the spinal canal. So remember, the spinal canal is the openings between all the vertebrae that go from the top, from the base of the skull, all the way down to the fifth lumbar spine. When we have this increase in pressure caused by loss of alignment, normal alignment to your neck, it increases the pressure in your lumbar spine by up to 30 times. There's no more room for error at this point. When people are younger, they can tolerate that increase in pressure, but as you get older and you've got the spinal stenosis situation happening, you cannot tolerate that increase in pressure any longer. So realignment of the neck naturally, conservatively, specifically can reduce this pressure in the spine and make more room for your spinal cord, allowing you to be able to tolerate this spinal stenosis. And that's how we've been able to help people over the years with spinal stenosis. So if you've been diagnosed with it, if you'd like to see whether or not conservative specific chiropractic care could help you, I would suggest that you give my office a call. It's 413-538-8808. A member of my staff will set you up for a complimentary consultation to see if chiropractic can help you with your spinal stenosis. So remember, keep your spine in line and you'll feel fine.